dear friends and colleagues. We as interpreters are constantly facing risks during our work. Sometimes those risks could involve even our lives or our freedom. Interpreters who work in conflict zones are constantly putting their lives at risk. They're jeopardizing their freedom as well. The interpreters that work in jailhouses or that work during police investigations are constantly exposed also to danger because of the type of work they do. Even interpreters, like in my case, who travel for living, we are constantly exposed to risks because sometimes we travel to dangerous places, to dangerous countries where anything can happen. Actually, even travel itself has a risk. Airplanes, trains, roads, all that implies some kind of risk. So risk is part of our career, is part of what we do as interpreters. However, now we are facing an even more terrible danger. We are facing the pandemic because the pandemic is still here, it's rampant, it's all over the world. So we're facing the risks of COVID-19, who could, in a good possible scenario, take us off commission for a few days during our quarantine. In the worst possible scenario, we could die. And a lot of things can happen in between those two, including having to spend a lot of time in a hospital, and depending on the country where you live, maybe dilapidating your lifelong savings because of this disease. So it is very important to keep in mind these type of risks. In fact, the risk went up the moment that the pandemic came into scene. We know some of our healthcare interpreter colleagues are constantly facing the risk because they work in hospitals and in clinics where the virus lives. They are in close proximity to people that have been infected, and sometimes because they are asymptomatic before people even know that they are infected. We know also that our court interpreter colleagues are at risk. In fact, some of them, unfortunately, have died in different parts of the world because they've been exposed to COVID-19. We know that people go to court and all kinds of people go there. There's people in close quarters, and that is a big risk. Now, that's at the courthouse, but the risk is even bigger for our legal and court interpreter colleagues who go to detention centers, to prisons, where, as we all know, the pandemic lives. And our colleagues that are court interpreters in immigration courts and attend court hearings or administrative immigration hearings, they're at a terrible risk. They are really coming in contact with people that just arrived from just about anywhere in the world, from countries where the pandemic is controlled, from countries where the pandemic is not controlled, from countries where people have been vaccinated, from countries where people have not been yet vaccinated. So the exposure is gigantic. Even in our case, as conference interpreters, we are at risk. One of the very first events that I did after we went back to some of these in-person live conferences was an interesting situation. We had visitors from other countries. We had people from all over the United States. And although the rules were very clear and people were supposed to be wearing face masks and be vaccinated, not everybody was complying. A lot of the U.S. Citizens and residents attending the conference, depending on what part of the country they were coming from, totally disregarded the face mask and social distancing measures. And of course, you could come, even if you were well guarded, somehow close enough to them to be at risk. And then we learned that some of the people that were attending the conference from abroad had not even been vaccinated. And we learned this because we saw that they were organizing groups to go get their shots here in the United States. And nobody had told us that. So conference interpreters are also at risk. Now, we do our part, and we should do our part by wearing masks, by keeping a good social distance from each other, by working one interpreter to a booth when we are working in person, and so on. But the best thing that we can do is we have to be vaccinated. We gotta get our shots. In my case, I was concerned at that conference, but I had been fully vaccinated for months. So my concerns were not as bad. And also I was wearing a face mask at all times. In fact, I was wearing two, one on top of the other. It's very important for us as interpreters, if we want to continue to do our job that is so full of risks, to be vaccinated and observe all the other public health measures, wearing masks all the time, keeping our social distance all the time, constantly washing our hands, and so on. We know that because of the work we do, it's not just interpreters ourselves who are at risk. We are also putting in jeopardy the health and the life of our family members, our neighbors, our co-workers, because everybody that you associate with, that you socialize with, is as if they had attended that conference, as if they had gone to that jail visit, as if they had spent the day at the hospital, as if they had been during the immigration hearing next to you, even though they weren't there. So we have to be aware of our surroundings. We have to be conscious of the fact and aware of the circumstance that when we observe all these measures, we do it not just for ourselves, but for everybody else that I just mentioned, people that we care for. So it is very important to do this. In my case, I got my booster last week, so now I have 3 times been receiving the vaccination, and I am very happy with that. I feel safer now, and I'm going to start doing more live events and even traveling abroad. This is important because now I can feel that in the future this might be our reality for a long, long time. The only side effect I got this last time with the booster was a sore left arm for about 24 hours, and then everything was gone. I was okay, and I was protected. I think that we have to be always aware of all these circumstances. So I ask you and I invite you, for the sake of our profession, of our colleagues, of yourselves, and for the sake of your relatives, friends, co-workers, neighbors, and so on, to please get the immunization shots. If you haven't gotten your jab, please do it, because it is very important. If you already got your first shot, get the second one. And if you are in a country where they are already offering the third one, the booster shot, to people who have already gotten their first and second, or the people that got the J&J vaccine, for them to get a second shot now, please go ahead and do it as soon as possible. We have to do it. We are interpreters. We work in the booth and we are constantly listening to scientists. We were working during the trials, and we saw what scientists were telling to physicians and to government authorities. We know this works. We work in the doctors' offices and hospitals, and we know what doctors and nurses are constantly telling everybody. So please, we as interpreters, we must listen to science. Please listen to science. Please go get your shots. Get your booster if you already got your first 2 shots. Please don't pay attention to those anti-vax attitudes. Anti-vax people do not know science. It's been demonstrated that the shots help you. So please don't listen to the anti-vax voices. Anti-vax attitudes only produce 3 consequences. Number 1, they kill people, because people die. Many more people die if they don't get immunized than those who got their shots and their boosters now. It also impacts the quality of life of everybody else around you. We all want to go back to the days when we could go to a movie theater, or get in the subway, or go to a restaurant and eat indoors. Hey, we long for the days when we could spend time in the booth with our colleagues and go all over the world traveling by plane and train to different conferences. But this is impacting everybody's quality of life because some people refuse to get immunized. Let's make sure that it's not interpreters who are contributing to this situation. And finally, the third bad situation that comes from anti-vax attitudes is that it hurts the economy. Let's face it, as long as we don't reach a certain level where the virus is under control, we won't have all the businesses reopening. We will not be doing as many conferences as we want to because there will continue to be restrictions to travel, to gatherings indoors, and so on. And this will hurt the economy. Businesses will continue to go out of business. Airlines, hotels, convention centers, and our clients. And if our clients go out of business, then we have nothing left. So my colleagues, please be smart. Do not be selfish. Get vaccinated. At least that is my opinion. Thank you very much.